Swayam Prabha. Digital India. Educated India.
I am Aparna Vedapriya, in charge professor and head of the department in the Department of Anatomy, Osmania Medical College, Hyderabad. Today's topic is facial nerve. So, when you come across a person whose face is deviated to one side and has drooling from the mouth and the tears coming down the eye, and few of the people who has vasculations over the ear with the same features of deviation of the mouth towards one side, and in few people who really have tears while they are eating. It's not that they are crying because they don't like the food, but whenever they eat food they do have tears coming down their eyes. And there are few people who cannot tolerate the normal environmental sounds like the tickling of a clock and nice music also. So, let us now see why all these symptoms occur. So, the facial nerve is the 7th cranial nerve and is a mixed nerve. It emerges from the pons at the pontomedullary junction of the brainstem and controls the muscles of facial expression and conveys taste sensations from the anterior 2/3 of the tongue. The nerves travel through the facial canal in the temporal bone and exit the skull at the stylomastoid foramen. The facial nerve also supplies the preganglionic parasympathetic fibers to several head and neck ganglia, that is the peripheral parasympathetic ganglia. The sensory root is also known as nervus intermedius because the sensory root of the facial nerve is lodged between the motor root of the facial nerve and the vestibulocochlear nerve. The functional elements and nuclei of the 7th cranial nerve. The special visceral efferent fibers which originate from the motor nucleus of the 7th cranial nerve belong to branchiomotor column. These branchiomotor fibers are destined to supply the muscles that are originating from the branchial arches. So, the muscles of the facial expression belong to 2nd branchial arch and the facial nerve is considered as a nerve of 2nd arch. So, these special visceral efferent fibers which arise from the motor nucleus of the facial nerve, they trace upwards, backwards, dorsally over the nucleus of the 6th facial nerve, causing an internal genu under the floor of the 4th ventricle, forming a facial colliculus. Then they descend downwards laterally and exit out at the pontomedullary junction related between the olive and the inferior cerebellar peduncle, forming the trunk of the facial nerve. This process of the motor fibers going round the abducent nucleus and exiting out forming an internal genu is called as a neurobiotaxis. The other fibers are the general visceral efferent fibers. They arise from the lacrimatory nucleus and the superior salivatory nucleus. They supply the secretomotor fibers to the lacrimal gland, submandibular and sublingual glands. They are the preganglionic parasympathetic fibers. The special visceral afferent fibers, they carry unique sensation of flavor from anterior 2/3 of the tongue. That is, they carry the taste sensations from anterior 2/3 of the tongue, with the exception of valate papillae and tympanic in the nucleus of tractus solitarius in the brainstem. They also carry general somatic afferent fibers from the skin of the auricle, more specifically the concha part of the auricle, and terminate in the spinal nucleus of the trigeminal nerve. The deep origin of the fibers to the nucleus is the corticonuclear fibers of the opposite side control motor nucleus that supplies the muscles of the lower part of the face. The corticonuclear fibers of both sides control motor nucleus that supplies the muscles of the forehead and the eyelids of the face, that is the upper half of the face. The superficial origin is the exit of the nerve from the brainstem is both the roots, that is the motor root and the sensory root, they join and exit as a trunk from the lower border of the pons between the olive and inferior cerebellar peduncle. The motor root is medial to the sensory root, because the sensory root is also called as nervus intermedius, which is between the motor root of the facial nerve and the vestibulocochlear nerve, which is lateral to the sensory root. The course of the facial nerve can be divided into 6 segments. It is the intracranial course, which is also called as cisternal course. Then it is the meatal segment. It is from the brainstem to the internal acoustic meatus. Then it is the labyrinthine segment from the internal acoustic meatus to the geniculate ganglion, and the tympanic segment from geniculate ganglion to the pyramidal eminence is the tympanic segment, and the mastoid segment is from the pyramidal eminence to the stylomastoid foramen, and outside the stylomastoid foramen is the extratemporal course of the facial nerve, which is seen in the extratemporal segment. The intracranial course or the intracranial segment is from the brainstem, the motor and sensory roots of the facial nerve join together at the pontomedullary junction and traverse the posterior cranial fossa before entering into the petrous part of the temporal bone via the internal auditory meatus. The meatal segment is from the brainstem to the internal auditory canal. It lies in the internal auditory canal. The meatal segment lies in the internal auditory canal, enters into the anterior superior segment of the internal auditory canal. Within the internal auditory canal or the internal acoustic canal, the 7th cranial nerve shares with nervus intermedius and the vestibulocochlear nerve, as well as the labyrinthine artery, and all these structures within the internal acoustic meatus are bathed in the cerebrospinal fluid. To know more about the internal acoustic meatus, the internal acoustic meatus is divided into upper and lower compartments, that is the superior and inferior compartments, by falciform crest. This is the falciform crest, which is dividing the internal acoustic meatus into superior and inferior segments. The facial nerve and the superior vestibular nerve travel in the superior portion of the internal acoustic meatus, separated by a spicule of bone which is called as Bill's bar. the lower segment of the internal acoustic meatus lodges the cochlear nerve and the inferior vestibular nerve. The upper segment of the internal acoustic meatus is further divided into anterior and posterior segments by a strip of bone which is called as Bill's bar. So, this Bill's bar divides the upper segment of the internal acoustic meatus into anterior superior quadrant and posterior superior quadrant. So, the anterior superior quadrant, which is in front of the Bill's bar, lodges the facial nerve along with the nervus intermedius, that is the sensory part of the facial nerve. In the posterior superior quadrant, which is posterior to the Bill's bar, lodges the upper division of the vestibular nerve. The labyrinthine segment is from the internal auditory canal to the geniculate ganglion. This is a very short segment and ends where the facial nerve forms the first bend outside the brainstem and is called external genu. This external genu also lodges the geniculate ganglion for sensory nerve bodies. From the geniculate ganglion, the first branch of the facial nerve, which is the greater petrosal nerve, arises. The greater petrosal nerve in its course forward is joined with the deep petrosal nerve to form the nerve of pterygoid canal. The nerve of pterygoid canal, which passes through the pterygoid canal, is relayed into the pterygopalatine ganglion, which is a peripheral parasympathetic ganglion. So, from the greater petrosal nerve, the greater petrosal nerve carries the preganglionic parasympathetic fibers from the superior salivatory and the lacrimatory nucleus, and those preganglionic parasympathetic fibers via the greater petrosal nerve and the nerve of pterygoid canal are relayed in the pterygopalatine ganglion. The postganglionic fibers from the pterygopalatine ganglion innervate the lacrimal gland, the nasal glands and the palatine glands. The tympanic segment is from the geniculate ganglion to the pyramidal eminence. The dotted one, the white dotted one is the tympanic segment. The tympanic segment of the facial nerve runs through the tympanic cavity. This is the inside of the tympanic cavity, which demonstrate this is the promontory on which there is the tympanic plexus. This is the tympanic membrane. These are the three ear ossicles, the malleus, the incus and the stapes. This is the opening into the mastoid antrum, which is called the adytus to the mastoid antrum. There is an elevation here, which is because of the lateral semicircular canal. So, this elevation is nothing but the facial canal, which lodges the facial nerve that is passing through the tympanic cavity, contributing for the tympanic segment of the facial nerve. So, now as the tympanic segment, the facial nerve which is running through the tympanic cavity backwards and downwards in the bony canal above the promontory and the fenestra vestibuli, reaches the medial wall of the adytus to the mastoid antrum, being medial to the incus, and is related above with the bulge of the lateral semicircular canal. Coming to the mastoid segment, which is from the pyramidal eminence to the stylomastoid foramen. This is the vertical path of the facial nerve. From the pyramidal eminence, the facial nerve takes the second bend where the nerve runs downwards as mastoid segment. In the temporal part of the facial canal, the facial nerve gives rise to nerve to stapedius, which innervates the stapedius muscle and also gives rise to cauda tympani nerve. This cauda tympani nerve supplies the taste fibers to the anterior 2/3 of the tongue and also supplies the preganglionic parasympathetic fibers which are relayed in the submandibular ganglion. So, this is again the middle ear where it shows the promontory and tympanic plexus. This is the tympanic segment of the facial nerve. After it is passing downwards and backwards, it takes the second bend here and then continues as the vertical part of the course of the facial nerve which belongs to mastoid segment. So, this vertical part of the facial nerve which gives the cauda tympani nerve about 6 millimeters above the stylomastoid foramen. So, the fibers, the preganglionic secretomotor fibers from the superior salivatory nucleus are carried along the trunk of the facial nerve through the geniculate ganglion, vertical part of the facial nerve through the cauda tympani, and it joins with the lingual nerve and are relayed in the submandibular ganglion, which is again a peripheral parasympathetic ganglion. The postganglionic fibers from the submandibular ganglion directly innervate the submandibular gland. But for the innervation to the sublingual gland, the postganglionic parasympathetic fibers from the submandibular ganglion again join with the lingual nerve and then innervate the sublingual gland. The cauda tympani nerve also carries the taste fibers from the anterior 2/3 of the tongue via the facial nerve and are relayed into the tractus solitarius. The extratemporal segment is from the exit of the facial nerve from the stylomastoid foramen to the parotid gland. This is the outline of the parotid gland. This is where the parotid gland is present. So, exit from the stylomastoid foramen to the entry into the parotid gland is the extratemporal segment. The facial nerve, as it enters from the posteromedial aspect of the parotid gland into the substance of the parotid gland, superficial to the retromandibular vein and the external carotid artery. The trunk of the facial nerve within the substance of the parotid gland divides into temporofacial branch and the cervicofacial branch. This is the temporofacial branch, this is the cervicofacial branch. The temporofacial branch in turn divides into temporal branch and the zygomatic branch. The cervicofacial branch in turn divides into buccal branch, the marginal mandibular branch and the cervical branch, which innervate the muscles of facial expression. Coming to the branches, the distributing branches of the facial nerve. The intracranial branches. The greater petrosal nerve, which is the first intracranial branch that arises from the geniculate ganglion, which is lodged in the external genu and provides the parasympathetic innervation to several glands like the lacrimal gland, the nasal glands and the palatine glands. This nerve also includes the taste sensations from the soft palate via the lesser and greater palatine nerves. it also gives a communicating branch via the lesser petrosal nerve to the otic ganglion, which joins the chorda tympani nerve, contributing for the alternate taste pathway. It also gives another branch which joins with the sympathetic plexus around the middle meningeal artery is the external petrosal nerve. Nerve to stapedius is another intracranial branch just beneath the greater petrosal nerve, which enters into the pyramidal process which lodges the stapedius muscle and supplies it. The chorda tympani nerve also arises from the vertical part of the facial nerve intracranially, about 6 millimeters above the stylomastoid foramen. This also carries the parasympathetic innervation to the submandibular and sublingual gland and carries the taste sensation fibers from the anterior 2/3 of the tongue back to the nucleus tractus solitarius. The extracranial branches. Distal to the stylomastoid foramen, as the nerve exits and before its entry into the parotid gland, it gives 3 branches, that is the posterior auricular nerve, which has its supply to the occipital belly of occipitofrontalis scalp muscle and posterior auricular muscles. The posterior belly of digastric and the stylohyoid muscles are also getting their supply from the extracranial course of the facial nerve before its entry into the parotid gland. After the facial nerve enters into the parotid gland, the 5 main branches which supply the muscles of the facial expression are the temporal branch, the zygomatic branch, the buccal branch, the marginal mandibular branch and the cervical branch. So, in detail of the branches of the facial nerve and its innervation to the muscles of facial expression. As they radiate out from the anterior border of the parotid gland, it takes an appearance of pes ancyrinus, that is the goose feet. It resembles like a goose feet. So, the first branch, which is the temporal branch, it passes upwards and forwards, supplying the auricularis superior and the auricularis anterior muscles, and it also supplies the frontal belly of occipitofrontalis and corrugator supercilii muscle and the upper part of the orbicularis oculi muscle. The zygomatic nerve supplies the lower part of the orbicularis oculi only, and the buccal branch. This buccal branch again divides into upper buccal and lower buccal. So, the upper buccal branch supplies the muscle called procerus muscle. The lower buccal branch again divides into superior and inferior trunks above and below the parotid duct. So, the branch which goes above the parotid duct supplies the nasal muscles and levator aliquinacea muscle, levator labii superioris, levator anguli oris, zygomaticus major and minor muscles. The lower buccal branch, which passes below parotid duct, supplies the buccinator muscle and the orbicularis oris muscle. The marginal mandibular nerve, it supplies the risorius muscle, depressor anguli oris muscle, depressor labii inferioris muscle and mentalis muscle. The cervical branch of the facial nerve gives its supply to the platysma. Coming to the summary of the various fibers that the facial nerve carries are the special visceral efferent or the branchiomotor fibers. They arise from the nucleus of the facial nerve, which receives its impulses from both sides of the cerebral cortex, and these the branchiomotor fibers which pass through the motor route of the facial nerve exit out from the pontomedullary junction between the olive and the inferior cerebellar peduncle, and then courses through the facial canal within the petrous part of the temporal bone, exits out of the stylomastoid foramen, enters into the parotid gland from its posteromedial aspect. Before the facial nerve enters into the parotid gland, it gives three branches which supply the occipital belly of the occipitofrontalis by posterior auricular nerve to posterior belly of digastric and stylohyoid muscles, and then as it enters, it gives 5 branches which are the temporal, zygomatic, buccal, marginal mandibular and the cervical branches which supply the various muscles responsible for the facial expression. To trace the secretomotor parasympathetic fibers which carry general visceral efferent fibers from the lacrimatory and superior salivatory nucleus, the impulses to these nuclei are forwarded from the hypothalamus via the dorsal tegmental fasciculus. From there, the general visceral efferent fibers via the trunk of the facial nerve, they are given out through the greater petrosal nerve, then the nerve of pterygoid canal, which are relayed in the pterygopalatine ganglion. The postganglionic fibers from the pterygopalatine ganglion are giving their supply to the lacrimal gland, the nasal glands and the palatine glands. The general visceral efferent fibers which run through the chorda tympani nerve are relayed in the submandibular ganglion and have their supply given to the submandibular gland and the sublingual gland. The taste fibers, which are special visceral afferent fibers, they carry taste sensations from the anterior 2/3 of the tongue excluding the circumvallate papillae, and they ascend up the trunk of the facial nerve and are relayed into the nucleus of tractus solitarius. The taste fibers from the soft palate via the greater and lesser palatine nerves and then via the nerve of pterygoid canal and the greater petrosal nerve also are relayed into the nucleus of tractus solitarius, which in turn are relayed into VPN nucleus of the thalamus and are relayed into the gustatory cortex, that is area number 43 on the same side in the cerebral cortex. The cutaneous fibers or the general somatic afferent fibers are carried from the concha part of the auricle and travel via the facial nerve and are relayed in the spinal nucleus of the trigeminal nerve. From the spinal nucleus of the trigeminal nerve along the spinal lemniscus, they are relayed into the VPM nucleus of the thalamus. From there, the third order neurons are relayed into the sensory cortex, that is 3, 1, 2 areas of the cerebral cortex. Coming to the clinical anatomy. So, when we look at the corticonuclear fibers which are given from the cerebral cortex, the nucleus of the facial nerve has an upper part and the lower part. So, the upper part of the facial nerve nucleus receives its fibers from both sides of the cerebral cortex, and the supply from the upper part of the facial nerve nucleus is only to the upper half of the face. The lower half of the facial nerve nucleus receives impulses from the contralateral cerebral cortex only, and it sends its fibers which supply both upper and lower half of the face of the same side. So, when there is a lesion above the nucleus of the facial nerve, which is called as upper motor neuron lesion, the fibers of the side, when they are having a lesion, the nucleus of the opposite side of the lower half does not receive impulses from this side of the cortex. So, the contralateral nucleus of the lower half does not receive impulses. So, the impulses are not given to lower half of the face only. That is because the upper half of the face receives impulses from both upper and lower part of the nucleus, which has its impulses from both the cerebral cortex. So, in upper motor neuron lesion, the facial palsy is seen on the contralateral lower half of the face. In the lower motor neuron lesion, that is when the nerve is injured or the lower half of the nucleus of the facial nerve is injured, then both the upper and the lower parts of the face on the same side show the signs and symptoms. So, the lower motor neuron lesions affect the ipsilateral side of the face, and the upper motor neuron lesion affects the contralateral lower half of the face. So, this facial palsy is known as Bell's palsy. So, what are the signs and symptoms that are seen in Bell's palsy, which may be due to trauma or any compression of the facial nerve? So, there is rapid onset of mild weakness and total paralysis on one half of the face. There is difficulty in closing eyelids because orbicularis oculi is paralyzed on that side. Irritation of the eye because the eye becomes dry as the eye cannot close. Changes in the amount of tears and saliva are also caused because of the facial nerve supplying the lacrimal gland and submandibular sublingual glands. And the drooling of the water from one side of the mouth on the lesioned side is also seen because orbicularis oculi suffers the function. The drooping in parts of the face such as one side of the mouth because of loss of facial expression is also seen. There is loss of nasolabial fold is also seen. So, the mouth is shifted on to the normal side. There is loss of wrinkles on the forehead on the affected side because of corrugator supercilii muscle is paralyzed. The affected ear may cause sensitivity to sound because of the nerve to stapedius that is being injured also. Pain in front and behind the ear is also seen. All this together appear like a mask-like appearance to the face. So, these are all the symptoms that can be seen in Bell's palsy. So, to look at the lesions of the facial nerve, when the facial nerve is damaged, after it exits out of the stylomastoid foramen, only the Bell's palsy symptoms are seen. If the lesion is in the vertical part of the facial nerve intracranially above the origin of the chorda tympani nerve, then the salivations of the submandibular and sublingual glands are hampered, and the taste sensations that are carried from the anterior 2/3 of the tongue are also affected. And the sensations from the concha, that is the somatic sensations from the concha, are also affected. In lesion number 3, which is above the pyramidal eminence, the symptoms that are seen are Bell's palsy plus loss of taste sensations and loss of salivation and loss of sensations from the ear auricle, and there will be loss of the supply to the trapezius muscle within the pyramidal eminence, which leads to hyperacusis, where a person will not be able to tolerate the normal environmental sounds. When the lesion is at 4, that includes the Bell's palsy, loss of taste sensations and the salivations of submandibular, sublingual gland, and there is hyperacusis that is seen, and there is loss of cutaneous sensations from the auricle, and also there will be loss of the lacrimation from the lacrimatory gland, and there will be loss of the secretions from the nasal mucosa and the palatine glands, and there is loss of taste sensations that are appreciated from the soft palate also, because of the involvement of the greater petrosal nerve and is at the geniculate ganglion. If there is any lesion at lesion number 5, all these symptoms are presented along with the injury to the 8th cranial nerve also, because through the internal acoustic meatus, the 8th cranial nerve also accompanies the facial nerve. And when the injury is at the 6th place, that is in the brainstem, which involves the abducent nucleus also, all these features plus the lateral rectus, which is supplied by the abducent nerve, is also paralyzed. So, there is medial squint with horizontal diplopia is also seen. Along with all the above features, there are few syndromes which are called as Ramsay-Hunt syndrome, where the sensory part of the facial nerve, that is the geniculate ganglion, which lodges the sensory neurons, is infected by herpes zoster infection. So, the sensory areas where the general somatic afferent fibers are carried will be shown a vesicular lesions in the concha of the ear, along with the other features like hyperacusis, reduction of lacrimation and salivation, and loss of sensations from the anterior 2/3 of the tongue, and the whole ipsilateral palsy, that is the Bell's palsy. So, along with all these lesions, there are vesiculations on the concha of the ear that are seen in the Ramsay-Hunt syndrome, because the geniculate ganglion gets infected by herpes zoster virus infection. Because of the injury to the nerve to stapedius, there is hyperacusis that is experienced by that person, where there is intolerance to normal ordinary sounds like nice melodious music, ticking of the clock, and routine environmental sounds. Even the whisper to such type of people is heard as a very loud noise. The crocodile tears syndrome, or gustato-lacrimally reflex, or it is also called as paroxysmal lacrimation. This is what is seen in person, where there is lacrimation that is seen when a person is having his food. This is a clinical condition characterized by paroxysmal lacrimation during eating. It is due to facial nerve lesion proximal to the geniculate ganglion, where the preganglionic fibers intended to supply the secretomotor fibers to the submandibular and sublingual salivary glands during the regeneration are misdirected and grow in the endoneural sheaths of the preganglionic secretomotor fibers, which supply the lacrimal gland. Whenever there is secretions from the submandibular and sublingual glands, the salivary secretions during eating, there is lacrimation also that is seen because of the misdirected regenerated fibers which go along with the greater petrosal nerve to supply the lacrimal gland. So, when there is injury to the facial nerve, the main signs and symptoms that are seen are in the face, and that causes facial palsy, which is called as Bell's palsy. At various stages of the facial nerve injury, the Bell's palsy also includes the loss of salivation, loss of taste sensation, hyperacusis, loss of sensory sensations from the concha of the ear, loss of lacrimation, loss of taste sensations from the soft palate, and loss of the hearing, as well as there can be medial squint along with horizontal diplopia also seen at various levels of injury to the facial nerve and its nucleus.